Hi, everybody. This is Cindy Kennedy, and you are listening to another episode of Living with Lyme. We have a special guest today, and it's Dr. Madiha Saeed. She's coming to you right from Illinois. She is also known as the Holistic Mom, and she's a board-certified family physician. She has a big flair for the functional wellness of people, and she's able to do it with young ones and middle-aged and old age, I guess birth to cradle, we could say. She is an author. She is working on her third book right now. She has been on shows. She has her own radio show, and I'm so excited to introduce to you Dr. Saeed. How are you?
Thank you so much. It's a pleasure to be here with you today. I'm so excited. Thank you.
Oh, thank you. Thank you. So, we were talking before we started to record that everybody in your family has to do with medicine.
Oh, absolutely.
How is that happening?
Actually, it sort of comes from, the side effects of too much love. I'm kidding now. But my parents actually sacrificed everything for us to be doctors. So we were born and raised in Naperville, Illinois. My dad quit his job. We sold our house. The entire family, literally moved to a smaller location just so we can get through medical school. They literally had sacrificed everything that they had, and even just to go just to basically down regulate, so then we can then he can support all of us going through medical school. So my brother's an interventional cardiologist. My sister's a pediatric ICU physician. I have another brother that's also in medical school. My husband / sugar daddy is also a physician.
I love it. My sugar daddy. Yeah.
My husband / he's also a family physician, and I have neonatal ICU and gastroenterology and psychiatry, so you name it. But that's when not a single one of us has any loans. So that's why and it's a huge blessing, because of the fact that I'm actually able to do now what I've always wanted to do in life, is really treat patients. Because unfortunately, in residency, when me and my husband were both interns, we had our first baby at that time. Both of us were working 80-hour work weeks, and family was far away. So it was lack of stress, tons of stress, lack of sleep. You're, obviously we had free food at the cafeteria, eating crap, because when you're not sleeping, you're eating more crap. When you're stressed, you eat more crap. So it's a huge cycle. The negative and social environment, because everybody's trying to tell you all the things you're wrong, not the stuff you're doing right. So it was all a collaborative of stuff that happened that sort of broke the camel's back. And then I developed shingles and Hashimoto's and lupus and digestive issues and acne and seborrheic dermatitis and all of these chronic severe constipation and digestive issues, hormonal imbalances. So I was a complete mess by the end of residency.
That sounds awful.
And not until I had more children, I was like, you know what? And they had some life-death experiences along the way. I walked into my daycare provider trying to kill my child in the daycare. So it was just, it was just craziness, where I looked at my life and I had to re-examine it, because all of us continue on this hamster wheel, right? And not until I saw that was my hamster wheel came to an abrupt halt, and I started to re-examine it. What she was actually walked in and she was suffocating him to death.
Why?
I know, it was craziness. So what was but when I saw that, and I was blessed the fact that the universe had saved my child, because I literally walked in at a time that my husband had that gut inclination. He goes, I feel like there's something wrong, go check up. And I was just chit-chatting. I'm the social butterfly. I was like, my kid's out a different way, great, I'm gonna have party here. But he was like, go check up on your son. And I was like, okay, I'm going. And I was like, psh, what is he talking about? He's fine. Walk in, and my nightmare unfolded. But at that time, literally, the universe pushed me to go see my son. And at that time, I was like, you know what? I promised the universe that I would take care of these children the best that I know how. But how can I take care of these kids the best that I know how if I myself was falling apart? If I didn't even know how to take care of myself as a family physician who is like one of the first doctors you go to, you know, you bring your family to try to keep you as healthy and happy as possible. If I myself was falling apart, how can I take care of anybody else? You know, how could I not take care of anybody else? So what was really crazy is that even specifically when I developed the lupus, and that's a disease that, you know, can kill you. So even at that time, I'm like, no, I watched my friend's mother die of lupus. I'm like, I am not gonna just take that social norm where you just take the medication and just live the life. So I went on this quest to look for an answer. I'm like, I need to stop, because every corner I turned, I felt like I was having another chronic condition. You know, to my with every physician in my family, consulting them on rotations with all these doctors, consulting like the head of the heads of our residency, and then also beyond. I looked and looked and looked and could not find an answer. Besides for when I looked at integrative holistic medicine. Right after residency, I joined this medical practice where under one roof, there was me, an OBGYN, an internist, an exercise physiologist, nutritionist, counseling, chiropractor, massage therapy, all brought together for the complete healing of the whole person. And I'm like, hey, wait, what's going on here? Because we're taught to like compartmentalize things. Like what we were taught that when your patient comes to us, that you're going to say one symptom and one symptom only. If you have another symptom, get lost, come back next time. We were never told to look at the entire symptoms, to look at all of the different, parts of the body, even mental, emotional, psychological, social, spiritual, all of those pieces to combine into one diagnosis or one treatment plan. So I then started implementing those. I had like the best of doctors and healthcare providers and, holistic practitioners all brought together for the complete healing. And then I was able to bring that to my patients. One of my first patients was a 31-year-old with 9 autoimmune diseases. 9. Myasthenia gravis, which is an autoimmune disease of the muscles, Sjogren's, Hashimoto's, digestive issues, lichen planus. I know she had a lot more, psoriasis. But she actually came to me because she was on the highest dose of Mestinon. And they wanted to put her on Imuron because of her deteriorating symptoms. What was crazy is that 1 month, and it's not like she spent a lot of money. She spent, she was at the Family Dollar store. She worked at the Family Dollar store and also a gas station. So with just these lifestyle tips that were cost effective, we were able to optimize her health and healing. In 1 week, 50% resolution of all symptoms. And then in 7 months, she now is a scuba diver instructor, which is unheard of with somebody who has myasthenia gravis, right? Because the fact that that's a disease of the muscle. So how can you be a scuba diver instructor when you need every muscle working at its peak?
What did you do for just 1 week?
So it's really just putting the body back into balance. Because no matter what we're doing, no matter what we're taught, right now in conventional medical setting, every 40 seconds somebody is dying of a heart attack. 6 out of 10 Americans and adults have a chronic health condition. 11 million people are dying just because of the processed food industry. And then it's not even just affecting us, but it's affecting our children. Where 54% of all American children have a diagnosed chronic health condition, and they say by 2033, 2025, if we continue at the current trajectory, 80% of all American children will have a chronic health condition. If that's not scary enough, 1 in every 4 will have autism by 2033. Now that is craziness. And we're not taught a single class of nutrition. We're not taught a single class of lifestyle, even though the statistics show, that it's directly related. I mean, they've done studies where, you're fed kids ultra-processed foods and they had 10% smaller brains and 7 points lower IQs. Like, where this is craziness. We know that this is affecting us. But let's now get back to what we learned in integrative holistic functional medicine, because obviously the way that we're going is not working. So, we're spending trillions and trillions of dollars on just covering up and band-aiding symptoms. So let's take a dive into exactly what is going on to really understand that disease process and how you can prevent it and heal it. And that all, when you go to a doctor, When you have asthma, they give you an anti-inflammatory. When you have eczema, they give you an anti-inflammatory. When you have allergies, they give you an anti-inflammatory. When you have a headache, anti-inflammatory. When you have an autoimmune disease, anti-inflammatory. When you have cancer, anti-inflammatory. You know what I like? So over and over and over, we're giving these anti-inflammatories. The doctors know that the underlying root cause is due to inflammation. But what we need to now do is to figure out why are they having inflammation to begin with. Unfortunately, me, my husband, and all my siblings and all the doctors out there, most of them have to go by an RVU schedule. So we don't get paid for how many patients we heal. We get paid for how many patients we see. So my husband has to see 110 patients a week for our paycheck not to go half. And that's craziness. So that's about like 15, at the most 15 minutes per patient. And in 15 minutes per patient, we don't have time to address why they're having inflammation. We just have time to band-aid the inflammation, send them out the door, just so they can keep on coming back to us, because that's the way that we're going to make our revenue. Broken system.
The hardest part of trying to practice good medicine.
Absolutely.
It's not putting the patient first.
It's not putting the patient first. It's basically just cranking them through this number, you know, like just taking a number, next patient, the next patient, next patient. And so
I have to step you back and ask you, so you got this woman, your first patient, better in a week. Was it primarily her diet that was the problem?
It was lifestyle. It was all of these patients, and not even just this first patient. I've had this one, actually he's one of my, he sort of adopted me now. He's second in charge of the United Nations. I have a patient who's second in charge of the United Nations, and he's 70 years old, him and his wife, 70. Lots of chronic conditions, rashes, diabetes, chronic pain, sweating, digestive issues, having indigestion since he was 8 years old. 1 week, all his symptoms are gone. And after now a year, he's off of his diabetes medications and all of that.
So
it is powerful. So it's not even just younger people, but also older individuals, just by targeting the reason why we have inflammation, and then focusing on my foundations of good health, which are digestive health and detoxification, and the 4 S's: stress, sleep, social, and spiritual health. But let's figure out exactly first what inflammation is in the first place.
Right.
Because inflammation is something that we're all familiar with. It's a life-saving, fierce reaction that the body's immune system, right, tries to fight off infections, heal from injuries, or even protect you from disease. So, but there's 2 different types. So I don't want to confuse everybody, because the fact that there's good inflammation and there's bad inflammation. So acute inflammation or chronic inflammation. Acute inflammation lasts for a short time, does what it needs to do, clears out, and serves a healthy purpose and is super beneficial. But then we have chronic inflammation. Chronic inflammation is also referred to as systemic inflammation that gradually destroys this beautiful masterpiece that we were all born with. And that's when, so it's basically this hidden, smoldering fire that is created by your body's immune system as it tries to fight off modern day's life of exposures to unhealthy food, stresses, toxins, allergens, and overgrowth of bad bugs, low-grade infections, right? That then all drive obesity and chronic disease. So for a little bit of inflammation, your body's able to keep it contained. But when it comes to constantly punched and punched and punched and punched and punched, your body gets these cytokines that are molecules of the immune system. They're important to fighting basically cancer and infections, and also tells your body this is friend and this is foe. So when they properly function, you can keep the fire contained. But over time, when they're constantly bombarded, they start going crazy, start destroying everything in its path because they're so confused, and leads to chronic diseases of every stripe. So just by understanding what inflammation is, and then really trying to figure out, okay, where is your individual deficiency? So not everybody's the same. But trying to figure out where are you in balance that is leading to that inflammation, that is leading to that response of the bodies to go haywire. Where is that? And I have people go through like your digestive health and detoxification, and the 4S is stress, sleep, social, and spiritual health. So really, I found that, you can spend hundreds and hundreds of dollars, maybe thousands of dollars in supplements and thousands of dollars in testing. But I have found that just with simple, easy, time and cost-effective lifestyle tips, you can put the body back into balance and heal not one symptom, but then all of them simultaneously. And not everybody needs all the billions of dollars of tests and, all that supplements. But it's a solid baseline that really is super powerful. And so I can go through those little briefs. I know you probably have had a lot of people talk about all these things on your podcast.
Well, not necessarily. What's of interest is, how do people do this? Now, one of my problems is getting people to buy into this and realizing how important this is, because they're not going to get better unless they use the tools that we give them. If you kind of say, oh, well, I eat gluten every once in a while, and you're like, your gut is a mess, you can't have it at all. Maybe down the road you may be able to tolerate some.
Absolutely.
But how do you encourage your patients to say, let's stick with this, because if we do it together and we do it for a time frame, you will feel better.
Absolutely. And, specifically, what we were taught was that we like to stamp people with diagnoses of being non-compliant. As soon as they don't do something, we're like, that just doesn't fit our, treatment option. We stamp them with the diagnosis of being non-compliant. But I think a lot of it has to do by empowering the patient. That if we can truly empower them and to teach them, guess what? Because a lot of times what happens is that when we start to go on this healthy lifestyle journey, we start blaming ourselves, because we all know that junk food is bad, but why are we doing that? But we know that not exercising exercising is good, but we still don't get to the gym, or we still don't, do 15 minutes of walking, whatever it is, we still don't do it. No, but see, it's hard. It's because of the fact that, our day-to-day activities, our lives, actually our brains have been hijacked. And to empower patients, because there's a new book by Dr. Perlmutter that just came out, which is amazing. It's called Brainwash. And he goes through about how these decisions that we make, so the decisions that we make on a daily basis are called, there's a huge science called, neuroeconomics. And that's the two main players in that decision making are your prefrontal cortex and your amygdala. So the prefrontal cortex is like a developed part of the brain that tells us like rational decision making, examines the pros versus cons and helps us think through our actions, and then, makes it after we look at the entire picture. But then the other one is like amygdala. And the amygdala is that one that basically is like the reactive part, fight and flight, just making irrational decisions, whatever we need to do. But so in order to really make rational decisions, we need to have both of them connected. But unfortunately, the food that we're eating, the lack of sleep, the increased stress, the lack of exercise, the lack of social environment, because all of us are on our media devices all day long, and all of this is leading to poor decisions, decreasing empathy, and fostering basically this, I'm against you mentality. But the thing is, what's really crazy is that once you show people that, it's not about making all of these changes, it's all about making one or two changes that starts to then form those connections. Because, for example, if you just tell the patient, just do this today, that's it, all you have to do. And in my office, I like to start every single solitary one of my patients, and I've been doing this over the last 14 years. And depending on where somebody is, if somebody feels like, I don't want to do all of it, gung-ho, fine, that's great, I'll give them a little bit more. But if they're like, I can't do this, I really want to, but I don't know what's going on, I give them one or two things. that will slowly then to start to build those connections between the amygdala and the prefrontal cortex that will then help them be more successful in the long run. And that I like to start off with everybody with that spiritual health. And I know that's like taboo and like medicine, oh my gosh, but the thing is, you know, we are mind, body, soul. And especially if we are negative, nothing's going to happen. I don't care how much you're going to be eating, what you're going to be, how much you're going to be sleeping. If you wake up, oh crap, I got to do this again, forget it. Not your entire day is shot. So I like to encourage people to start with just one thing, and that is be grateful. Immediately when you wake up in the morning, I want you to say 10 things that you're thankful for. They've done studies where if you have a heart, you know, if you're frustrated, your heart rate variability is like all over the place. But when you live a life of appreciation, when you are thankful for every little itty bitty thing that's going on, and yes, I know you may be suffering. Especially when we're suffering, when we wake up, we start to just, again, we're consumed in that suffering. But we have a roof over our head. We have shoes on our feet. We got clothes to wear. We have eyes that work. You know, we have beautiful hair, you know, whatever it is. But we have to focus on the million things that the universe is putting in our favor versus the couple things that is not in our favor. And that's why when you shift that, when you shift to a world of appreciation, your heart rate variability is a nice sign. So everything starts to work better. And you start to form those connections between the amygdala and the prefrontal cortex that, guess what? I can do this. Yes, I can do this. This life is worth living. I'm going to do, and even if it's just small things, start there. And so I have every one of my patients start off with gratitude. Then we have is, you know, making sure that they're sleeping properly. Just again, simple things.
That's hard because people are attached to their computers or their phone and that blue light, and they're not making their melatonin, and they're
absolutely
not, you know, they go, and then it's like, gotta go to bed, boom. And they're not having that time to kind of what I call power down. Mm-hmm. And when they don't have that transition, it's not a peaceful and restful sleep, or they're going to bed too late. Mm-hmm. And I always tell my people that if you can get in bed by 10, between 10 and 2, you're actually getting time and a half, or even time of your body's rest, because that's kind of the period of time you get your best sleep.
Absolutely.
So people,
you know, the lack of sleep, absolutely, it's causing us to really get sick, because 1/3 of American adults are getting less than the recommended hours of sleep. So that's craziness when it comes to like and they've done studies where if you this lack of sleep, you're unable to perform the tasks that you need. You know, there's more inflammation, there's hormonal imbalances, there's excess toxins. Just 1 week of sleep deprivation can alter the functions of your genes, those that are included like metabolism, immunity, inflammation, and even stress. So this is really important to try to incorporate this, because again, and I talk to people first what I always do is when I want people to change their lifestyle and their habits, I explain to them the importance of it. And so like, for example, my kids, I'm like, you know what, you're healing in your sleep. So if a 12-year-old can understand like, oh, I need this for healing, then it gives us more motivation to put this down. That if we don't, we're just going to get sicker. Then what's the point? How is this going to benefit you? It's just going to make you sicker. So because once you can educate them that, you know, that sleep can actually help you make better decisions, help you be more productive, and actually can even lower addictive behaviors, that really empowers somebody. And to create like a routine, right? And that routine is super important, just like what you're saying, it's like you got to power it down. Incorporate the meditation. I have a lot of my patients, like they feel like they're go through the day, they don't have to meditate. I'm like, but you can meditate right before you go to bed, yes? And they're like, most of them can. They're like, yeah, you're right. And to incorporate, and that comes to my next S, is like, you know, we have the stress. Stress leads to 80% of the complaints that come to primary care physicians are due to stress. So, and guess what? Not a single one of us was taught, I mean, very little. I mean, not that I know anybody I know is taught stress management.
Yeah, we
Everybody, when I got
have
sick,
our own, you know.
yeah, because they're not doing it on their own. Absolutely. And when I got sick, I realized that, you know what? And they because the doctors were all like, oh, it's just stress. And I'm like, I know it's freaking stress, but what am I supposed to do to decrease the stress? Like, I'm sick and tired of you telling me that it's stress without giving me a solution. But if 80% of the complaints that come to primary care physicians are due to stress, then guess what? Does it benefit us to teach you stress management or hurt us to teach you stress management? Something to think about. And this is why we have to empower the patient, that just incorporating some sort of stress management techniques into your daily routine can help to motivate you, heal you, lower those, hormones and those things that, basically throw everything out of balance, and help you heal your gut. Because remember, stress can really destroy everything from the vagus nerve to your hormones, kills your gut bacteria, all of that fun stuff. So we want to make sure that you incorporate some sort of stress management technique into your daily routine. I like to have people do it either in the morning time, during the middle of the day, or even the night before they go to bed. And it just has to start off with just 5 minutes, then go to 10 minutes, then just slowly increase. We don't have to make this like, oh my gosh, it has to be like this perfect, we have to do it for 20 minutes. Just start with 5. Just start with something, 1 minute. And now those simple changes can really help to empower.
Yeah, people think that meditation has to be some esoteric kind of crazy. They don't. I use the, I tell people 3 times a day to get started.
Absolutely.
I want you to stand there. I want you to feel the air. I want you to sense what's around you. I want you to feel what you're sitting on or laying on or whatnot, and then concentrate on 3 deep breaths. And sometimes just concentrating on the breaths can actually, and they're like, that's meditation. I go, yes, that is actually being present. And that is the beginning of meditation.
Absolutely. Especially in this day and age, and to really start to empower a patient with education, and to really, educate them that we are now being bombarded by stress on a daily basis more than anybody else. I mean, a long time ago when I was growing up, there was an answering machine, and we only checked that answering machine 1 time at the most. If we got to it, we got to it. If we didn't, we didn't, right? But now it's like notification after notification. Then we have all these different notifications. We got to make sure. It's like constant stress, because this new age of internet and social media, I mean, seriously, 70% of the world population now has a cell phone. So this is like, and people are spending, there's studies that more than 2 hours just on social networking. And then there is like 42% of the time we're in front of a screen. This is all this mindless activity, plus on top of that, all the negativity that we get from our cell phones is destroying us. And social media is not even really social anymore. Social media is like isolation. They've done studies where you put the more a child, or especially for teenager, is on a device, the more depressed they are, and the more they feel like they're lonely, the more loneliness they feel. So we have to bring back the social environment also, and start to incorporate that in the child's life or the adult's life, to make sure that you keep with people that are going to lift you up, not drag you down, because love does heal, right? It releases all those oxytocin and hormones that basically lower the stress response systems that help to then improve and heal overall inflammation and optimize your mitochondrial function, which is a powerhouse of the cell.
It is.
So,
you really need
so
that.
just these simple things, and then we have, so that was stress, sleep, social, and spiritual health. And then we have is digestive health and detoxification. Because the foods that we are eating are destroying us. It's putting, and not even just destroying ourselves, it's actually putting our economy and our environment with like climate change, and destroying our oceans and waters and marine life. Like, we are literally dying as a planet and as a world. And, you know, food has drastically changed over the last 40 years. You know, in the first part of the 20th century, that's when these chemically altered food substances started replacing these real foods. And now they're like bioengineered, that lack of nutrition, you know, costing us billions. And on top of that, we're becoming just, yes, they lack of nutrition, but they have higher energy sources we are basically becoming obese. You know, they say 1 in every 5 deaths in 2017 was due to a poor diet. 70% of deaths worldwide are due to a non-communicable disease. And it is just getting crazier and crazier and crazier, to the point where we have like 50,000 actually edible plants out there, but then we're only eating 8% of it. You know, 2%, actually 2% is just 2% of the farmland that we have out there is just to grow fruits and vegetables. 59%, unfortunately, is to grow commodity plants like corn, soy, and wheat. I mean, it is craziness that we are just not eating. Like 90% of Americans are deficient in 1 or more nutrients. Like, there is something going on. If that's not going to drive disease, I don't know what else will.
Well, the whole thing with the gut and the
absolutely
option of the gut, people are not able to absorb the nutrition. You look at women with menstrual irregularities. You look at women with osteoporosis. You know, some of that may be, you know, lack of the appropriate nutrition, but I think of it as well as their gut being unable to absorb.
Absolutely. And what happens is that, you know, the difference between somebody with a problem and somebody without a problem, if we say the same anatomy books and we say the same physiology books, if we're all the exact same on the inside, it's our environment that makes a difference. And the biggest connection between our insides and our outsides is through our gut, right? And our gut has 70 to 80% of our immune system. It has 100 trillion bacteria that line your gut lining. And these bacteria are responsible for digestion, metabolism, gene expression, making your neurotransmitters, and they make 90% of your serotonin and 50% of your dopamine. So if that's not crazy enough to take care of these poor little critters, I don't know what else is. Because what happens is that when you eat good food and pure food and natural foods and real foods, not fake foods, real foods and in a real environment, no toxins in the environment, all of that usually, you know, there's between your poop and the inside world, there's basically just one cell lining. And that cell lining normally should be nice and tight. But over time, what happens is that all these artificial foods are killing off these good bacteria and getting replaced by bad bacteria. These bad bacteria are not doing their job well. They're letting things through that should not be getting through. 70 to 80% of the immune system says, hey, I'm going to attack you. So it leaves immune complexes all over the body, and it leads to chronic diseases of every stripe. So that's just one piece of the puzzle, right? Food. So food is one piece of the puzzle. Because whenever you eat food, you want to make sure that it helps you heal the gut bacteria. And the other part of the puzzle is how the food affects your hormone levels. And this brings it right back to what you were talking about with like the, you know, off balance and with the hormonal irregularities. What happens is that most of the foods that we're eating are so processed. That is leading to, normally what should happen is the glucose, in order to enter the cell, needs a key. Key is called insulin that's released from the pancreas, opens the cell wall, and lets the glucose in. But when it lets the glucose in, everything works fine. But over time, especially with the foods that we're eating, cornflakes raises your blood sugar level higher than sugar does. I mean, the foods that we're eating are completely, I mean, they're not really foods. And the more processed they are, the higher they raise your blood sugar level. And now on top of that, you add the chronic stress, the lack of sleep, the lack of social engagement, the lack of, you know, nature. So all of these things are leading to so many problems. And on top of that, it's not letting the glucose in because the fact that because your blood sugar level is elevated all the time, it says, hey, I don't need to listen to this. So therefore, this is a state called insulin resistance, where it's not listening, your cell's not listening to the insulin that's there. So it raises your insulin levels to try to just get something to get into the cell wall. But what's really powerful is that just by, focusing on foods that will help heal you, heal the gut, balance your hormone levels, and are the most nutrient dense foods, you can lower inflammation and heal not one symptom, but then all of them simultaneously. Because remember, gut health is just one piece of that puzzle. The other one is this insulin resistance that leads to brain fog, sugar crashes, carb cravings, weight gain, you know, so just basically dizziness where when you have to eat something, otherwise your blood sugar is going to drop.
Hangry.
Hangry, absolutely.
And hangry.
So in my house, that's what we do. When we talk about food, we want to make sure that they go through a list. My 12-year-old to 4-year-old are like, Mama, I had my vegetable, my healthy protein and fat. Now can I have a carbohydrate, a fruit? And I was like, sure. So they go through a list. So instead of focusing on the foods that they can't eat, let's focus on the foods that they can eat and empower them from the inside out.
Right.
So, and then obviously then there's toxins, because, toxins right now are really destroying our health. And those toxins are, making our body numb to insulin, because normally what should happen is that these toxins, the toxics whenever we are exposed on a daily basis to these toxins, they have to go through, when they enter our body, they have to go through our liver. This liver is an organ responsible for moving and getting rid of this toxin. It'll get out. But when it's overwhelmed and are bombarded in every which way of toxins, then what happens is it can't eliminate it and tends to store it. And it's unable to do a job, increasing inflammation, leading to leading to chronic diseases like autoimmunity, cancers, blood sugar issues. It makes your body numb to insulin, like we talked about, and then increasing our insulin resistance, preventing somebody from even losing weight, heart disease, strokes, even can change our genes and influence leaky gut, lead to leaky gut or increase intestinal permeability. So again, keeping the society around you, keeping your the environment around you as clean as possible. So if you're not going to put it on in your body, don't put it on your body, and don't clean with it. Don't use it as detergent. Don't wash your dishes with it, because it's going to eventually get inside.
Yeah.
So it's simple.
I was just thinking about all these environmental things that people are now talking about. We have issues with mold and mold toxicity, and then that certainly can take over your
absolutely
and those kind of things. So we have to always think of not only the toxins in the environment that we're breathing in or on our skin, etc., but things that we're exposed to, and half the time people don't know. And the same thing with these illnesses like Lyme disease, where people don't know. In my mind, I'm thinking that keeping the gut healthy, regulating your stress, getting the best sleep, your immune system can probably do a better job fighting off
infections. Absolutely. Because with chronic infections, if it's not one, it's probably another, right? There's all of these different, certain microbes that, affect autoimmunity or the conditions, so all of these, because again, what you just said, leaky gut, inflammatory foods, lack of sleep, disrupt your balance of your immune system, and can reactive, and sometimes what happens is it can reactivate even a dormant infection and trigger your immune system. So this is where really trying to, find a practitioner that with ample experience to try to figure out, where are these imbalances coming from, working with a practitioner to optimize this solid base of ours. Because remember, to defeat any infection, no matter if it's viral or bacterial, fungal, viral, no matter what infection, parasitic, that we're going to need to still optimize our immune system. And gut healing and the right diet, maybe some supplements, can all help with that healing process. And then after that, you can find a practitioner that can help treat you with either pharmaceuticals, nutraceuticals, combination of both, and then go from there. But really, that baseline is really key to get rid of any chronic infection that you're trying to deal with.
Right, because a lot of times people are just like, kill it, it'll go away, I'll feel fine. But a lot of times it's what you started with that probably allowed that to take hold of your body. And
Absolutely.
once, certain types of infections, either the dormant kind like the viruses or the bacterial ones like Lyme, it can really work, do a terrible number. And
Mhm.
it's kind of like you're flooded, and then you have this cascade of inflammation that we were talking about.
Mhm.
And then you've got all this collateral damage. You might get to the point where, yes, you're better. You've really done a number on wiping out these problems or putting the viruses back to bed, but the collateral damage is probably one of the hardest things people have to deal with after
Absolutely.
a long infection. Do,
Absolutely.
do you see autoimmune antibodies return to a normal status with change in all of the behavior?
Absolutely. I've had my dsDNA antibodies were 1 by 380.
What is it?
My dsDNA antibodies, which are basically ANA with anti-nuclear antibodies.
Oh, I thought you said D.
Yeah. So then there's different types. So there's anti-nuclear antibodies, and then there's subtypes.
Okay.
So of that, the dsDNA, so the
Okay.
double-stranded DNA antibodies. So basically, I had antibodies that were attacking my nucleus and my gene, like our genes of every cell. Like, this is craziness. Attacking the DNA, and my levels were 1 by 380.
Really?
Yeah, and not until I was able to get myself back into balance, and even and it does take time. So I was doing all these other things. I was doing it, and then after 3 years, I'm like, oh, why can't I get it? I got it down to 1 by 180 and 1 by 80, and then I was like, okay, what else is going on? So you're always looking, because remember, this is like a work in progress. You are a work in progress, and it's not about the destination; it's the path. You got to make sure that every day that you are healthier than the day before. That's all that really matters, because nobody knows how long they're gonna live. When you've been given a cancer diagnosis, when you've given a diagnosis of autoimmune disease, we are freaked out that, oh my gosh, we're gonna die, we're gonna die, we're gonna die. But guess what? All of us are gonna die. Life is life threatening. We are all gonna die. So we need to now, instead of focusing on the destination, because none of us know what that destination is, we got to focus on every day being the best that we can be. And so I was looking at my own self, because I'm like, yes, I was trying. So I'm like, okay, what am I doing? Every day I'm always thinking, what can I do today that's better than what I did yesterday? And for me, I was doing the diet, the digestive health and detoxification, the 4S of stress, sleep, social, and spiritual health. But then I realized that there was one place that with my body was trauma. So I had to deal with my own underlying trauma in order to really heal. So not until I dealt with my trauma, there's an amazing book called Your Body Keeps a Score. Not until I was able to change the gift wrapper that my trauma came in, and say, instead of just pushing it away, but to really focus on the fact that it's there, it has made me a better person who I am today. So for me, I look at it as like, oh my gosh, if I did not have that trauma, how would I raise 4 boys? I would not know what not to do. I would, but not to the extent that me dealing with that personally. And like literally for me, I thought God was like punishing me for giving me 4 boys. I was like, are you freaking kidding me, God? Like, I hate men already because of all the trauma that I've been through. And now you're giving me 4 boys. Like, this is, but it's because you have to look at it. Like, now I'm going to, instead of, healing broken men, I'm going to raise this society of these children to really be the best that they can be, right? And to be leaders with any child. But I had to change that dynamic. I had to change the gift wrapper, that I'd be thankful for what happened, so then I can be and treat these children and take care of these children and educate them the best that I possibly can. To kiss the ground that women walk on, to be leaders, to take care of their own bodies and take care of the earth. So just when I was able to get past that, get out of my own insecurities, start doing things that was making me uncomfortable, and on top of that, increasing my self-esteem, focusing on the gratitude, I was able to get out of my box that the trauma put me in and live life to my fullest, plus enjoy life to the fullest. And now when I checked my antibodies a year ago, gone, negative. So same thing that happens with TPO antibodies and antithyroglobulin antibodies. I've seen them, but if there's still something going on, instead of saying, oh, nothing's working, it's not working, whatever, I mean, that's a negativity in and of itself. Because it's a path. Every day you have to say, okay, step back. What is going on? Where am I off balance? What else could be going on? Maybe it's something in my environment. Maybe it's a food sensitivity. Maybe it's a methylation issue. Maybe I have to check out my genetics. There's so many other factors. So that can, if you start off with that right away, that can really confuse people. But for me, I have them always start off with digestive health and detoxification, the 4 S's, stress, sleep, social, and spiritual health. Solidify that first. And then if there's still something off balance, start looking at the zebras. Start to examine your life. And that way it's like beautiful because we really live mindfully then. Every bite that we take, everything that we do, everything that we see, everything that we touch, everybody that we talk to, we live a mindful life. So it's really, really nice that focus on the baseline, then start to examine your life and trying to see, okay, where else am I off balance?
How do you help people detoxify? That's always a big one because you don't want to push it too hard, but you really want them to concentrate on the elimination process. And
absolutely.
Yeah, we start with pooping, right?
Yeah, you start with pooping, obviously. Pooping, sweating, massages. I actually, I give them like a little notepad and I write just like an RX pad, my little prescription pad. And on my prescription pad, I write daily massages from significant other without secondary benefit. So
yeah. How is that possible? That's impossible.
That's why I have to write it there because I know as soon as they start massaging you, they want something else. But what the thing is, you need to now focus on massages. I mean, those are simple ways to really dry brushing. I mean, starting with that dry brushing. These are simple things that you can incorporate into your daily routine that are cost effective and really powerful. And you don't have to go out. I mean, saunas are great, but you don't have to go out and buy a sauna. Start with just dry brushing. Start with massages, peeing, making sure you're drinking enough water, just to make sure you're peeing properly and often. And then pooping, making sure you're going at least 1 to 2 times a day. Start with those basics. And then I have them also incorporate Epsom salt baths. Epsom salt, sea salt, baking soda, alternate them, baths. You can even add seaweed to detoxify. So all of these can really help. I mean, in my house, the kids get in a bath at least 2 to 3 times a week, an Epsom salt bath. And I try to also get it in as much as I possibly can. And then right before that, so we dry brush, add the Epsom salt baths. Then we do the hot and cold with the shower, right? Because if you go from hot and cold, that really helps to stimulate your detoxification pathways. And so do like a minute cold and then a minute hot in the shower. That also really helps. That's a little bit harder for most people to do, but just start out. But what I wanted to show them was that there's so many different ways that you can detoxify.
Right.
One thing, I mean, it's not one way works for everybody. But remember, the food that you eat, the thoughts that you have, your lifestyle should be a detoxification. With sleep, you detoxify. So there's so many different ways by focusing on the foundations of good health, digestive health and detoxification, the 4 S's, stress, sleep, social, and spiritual health.
Then
adding in.
You're saying 3, but you mean 4, right?
Stress, sleep, social, and spiritual health. Yeah.
Okay.
Yeah, the 4 big S's.
Okay, 4 S's.
The 4 S's. So digestive health, detoxification, the 4 S's, stress, sleep, social, and spiritual health.
Yeah.
And really just starting from those basics, because remember, all of that will help you detoxify. All of that will help you sleep. All of that will help your gut heal. All of that will optimize your mitochondria. You get the picture?
Got the picture. I got the picture. And you know what I want? I want people to hear is something I say often, especially women. I see women the most part. We encourage the men to come in because they're the ones that show up in the emergency room with the heart attack and cost us a whole lot more. We know that, but for all the ladies and all, I tell them, what's the one thing you can do to save your family? Because they're always worried, my kids, I got so much to do. Oh my God, and Jimmy's going to baseball camp, and I say to them, you know what? If you and your kids were in a canoe and it tipped over, and there was only one life vest, who would you give it to? And a lot of the women would say, well, the youngest, or the weakest swimmer and whatever. And I would just say, no, no, no. And I say, no, you put it on, because if you can save yourself, you can save your family. So the point being is, put your oxygen mask on first.
Absolutely.
Yes,
Because you can't give from an empty vessel. We keep on trying to give from an empty vessel, but if we don't satiate your own needs first, then you can't give. You need to give whatever is tipped out of your vessel, then that's what you can give around, So it's really important to, yes, take care of yourself first.
Yeah, women as moms, especially working or doing other things, even for themselves, they feel guilty.
Yeah.
And that has to stop.
That has to stop.
That has to stop.
Yeah, no, because, and then that too is just like,
Gotta stop.
it's gotta stop.
Yeah, because you have to be true to yourself.
And if when you take care of yourself, you are a better everybody. Like, you are a better person, you are a better mother, you are a better wife, you are a better girlfriend, whatever it is, you are a better person.
Right. And there are things to do. I felt bad when I was a young mom. There was a whole thing going on called Mommy Wars. And it was the stay-at-home moms, kind of against the working moms. And there was that, sassy stuff about, oh, well, you missed this, or you didn't get to do this, or whatnot. So I took it to heart in the beginning, but then I had to stop and think of what better things I can provide and what I can be. And I enjoyed not talking all day long. I enjoyed education.
Absolutely.
And, I enjoyed teaching, and I enjoyed caring for my patients. And so then I said, okay, well, what can I do? And I have 3 daughters, and they were all close in age. And so one by one, I would spend 10 minutes. Doesn't sound like a lot, but when your kids don't have a big attention span, it's like the whole day. And okay, let's do something. What do you want to do? You want to make a puzzle, you want to read books, you want to just talk, or whatever. And it was one-on-one time. And usually by the time it was closing in on that 10-minute mark, they were up, see you, Mom, gotta go, and so they were happy. I was happy. You have to be creative in certain things. We used to do Sunday morning crafts. We used to get out the, whatever we had in the cabinet, whether we make, I don't know, macaroni necklaces. Remember those? You have boys. I don't know if you made macaroni necklaces, but there are ways around it. And I think so often people get frustrated, so they don't make any change. They continue to do the same thing, or they fear failure. I can't change my diet, or, I've heard the big money factor. It's too expensive to eat good. And my answer to that is, it's too expensive for you to get sick and not be able to take care of your family or to work or whatnot. Do you have to get everything organic? No, you don't. But let's pick the most important things and work from there. Yeah.
Absolutely.
Yeah. And that's what we have to do, and I think that when patients get confused because their primary care doctors are telling them one thing, and they're listening to us, we have to leave it open for interpretation a little bit. We should not be totally negative. We can always say, well, in my experience, instead of saying, I don't agree, that doc's a jerk, which I've said too, but but really, letting people understand that, yes, there are different ways, different types of care. Yes.
There's so many doors. And, conventional care is great for acute care, but when it comes to chronic care, they've missed the boat. But then that's why there's so many different avenues, and what works with somebody doesn't work for the other person, so we everybody is tailored their own individual way. So we just got to keep on respecting that, and really empowering each other with positivity and gratitude, and showing and educating them that, small changes can make huge results for a happier and healthier living.
I appreciate that. That is so great. And this has been wonderful. And I encourage everyone that's listening to really take it to heart, to be grateful. Just say, I'm happy about X. I know that you're suffering. I know that you have issues. But if you can break away from that a little bit, even for a few seconds, a few times a day, and
Absolutely.
yeah, it really, it isn't going to hurt you, right? It really
Absolutely.
isn't going to hurt you, and it may very well help, you, it may help your family, a smile, anything that you can was really, 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 really important, and you have to take that.
Yay.
Oh, Dr. Saeed, this has been a wonderful interview. You have
my pleasure.
lot of positivity that I really, really know that if you are working with your patients, I think that you can instill a lot of positiveness. Just
Absolutely.
oh my goodness, for forever. This is just a wonderful thing, and I'm so excited. Tell us the name of your last two books. I want to know. I want everybody.
So one of them is, the first one's The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease. And actually that one is coming back on paperback. So it's really exciting. It's done really well. Bestseller. And then the other one is Adam's Healing Adventures.
Is that a child's book?
It's a children's book. Yeah. So
I like that one. I'd rather read that one.
Yes. And that's what I'm trying to do. Like really trying to create this series. And I'm hoping that it's called Adam's Healing Adventures. And the first one is basically from sickness to health. And, so that's super powerful. And I'm hoping to continue it with the series, where he discovers meditation, when he discovers gratitude, when he discovers all these different pieces a little bit more detail in each book. But so this is the first one. The second one and the third one's more of an international book, and just really trying to get the message that eating biblical food can help heal us from the inside out. So that one's going to go globally, so that's really exciting. So I'm tailoring it for a global audience.
That's amazing. Congratulations on all.
Thank you so much. And then I just signed another agent contract for my fourth book, The Holistic Kitchen, Healing Recipes from Around the World.
Wow.
So I got a lot of fun stuff in the pipeline. So stay tuned. You guys can check me out on holisticmommd.com.
That's awesome. And this is all wonderful. Your family must be so proud of you. Your sugar daddy must be so proud of you. So great for everybody. This is Dr. Madiha Saeed. She is this wonderful healing mama, and I'm so proud to know her, and I've been so thrilled to have her to speak with all of you. Come back, listen to us again. Everybody take it well, take it slow, and be gracious.